And the National Economic Council says it is worried about the spike in new COVID-19 infections in Nigeria and is seeking additional measures to manage the situation. At the Council's monthly meeting in the federal capital, Abuja, it raised concerns that over the sudden rise in new infections, it also blamed the surge on non-compliance with laid down health guidelines, such as wearing of masks, social distancing, and hand washing. It cautions Nigerians against activities or behavior that may worsen the situation and result in another lockdown. The National Economic Council said it was enlarging the membership of its current COVID-19 ad hoc committee to urgently consider and propose additional measures to manage the situation.
After very fruitful deliberations today at NEC, ably presided by His Excellency, the Chairman of the Council, the Vice President, Professor Yemi Osibanjo, the NEC resolved, and after deliberations, especially on the upsurge on the issues of the COVID-19.
The Honorable Minister for Finance, Budget and National Planning reported to the Council that the underlisted accounts as at 17th of December 2020 are as follows. Excess code account, ECA, $72,410,574.808.
Now here to speak on the second wave of COVID-19 is public health expert, epidemiologist and research scientist, Dr. Mollie Epstein. Welcome, Dr. Mollie. Just out of interest, we talk of a second wave, and yet some, especially in Nigeria, aren't clear that we have even peaked or where we are with the first wave. What are the parameters with which we established that we're facing a second wave in the first place?
Well, I think the way that people are talking about the second wave at this point is that at one point we did see some sort of a peak in June or July, but it really isn't. It's still the same COVID-19. And over the last couple of weeks, we have seen a significant spike in new cases of coronavirus, up around 800 cases per day in Nigeria. And that is significant cause for alarm. So whereas we're talking about a second wave may not be the right way to think about it, there is an increase. And we have to assume that for every one person who gets tested and who gets a positive case, there are probably another 10 cases out there that are not getting tested positive. So it's probably a significant concern right now.
And what's likely to be the difference this time around? What would a second wave in Nigeria look like?
It could potentially look like additional sets of lockdowns. People at this point are starting to become more lax in the way that they are acting. They're not they're not distancing, they're not masking. This is the same as it is sort of the world over. The United States is having similar problems. And but it's also now it's getting to be winter as well, and it's getting colder. People are staying inside more, and people are not wearing their masks indoors as much. So there are there are additional things that people should be doing. They could be using the telemedicine platforms instead of going to queue up outside, outside clinics. So there are lots of additional things they could be doing that we are hoping that will be suggested.
Okay, there has been the criticism, especially at the onset of the epidemic, that Africa and even Nigeria tended to opt for a copy and paste response to the virus. And so maybe suggesting a lockdown may not be tailor-suited to our circumstances, because a lot of people are not with the means to live from one day to the next if they were shut out in their homes. So perhaps are there other alternatives we should be considering in Africa, maybe shielding of the more vulnerable parties, rather than resorting to what is being adopted in the West?
Definitely. I think there are lots of additional options. So lockdowns are sort of a very heavy-handed response when it's a top-down response like that. That's for when you know it's going to get bad. for people to try and avoid that sort of lockdown, distance, use masks, stay away from crowded areas. But even when you're around your family, it's better to, aside from like the people who you're in your bubble, do stay masked, especially if you're in like, areas. Try not to go to a bunch of big gatherings, or and if you are around a bunch of people, definitely wear a mask. There are also, and if you do get sick, there are like telemedicine platforms. Like one of the reasons why we're building out CribMD, which is the place where I work, is we're hoping that people stay home and like use doctor house calls or use telemedicine instead of grouping together in large places. You work in the clinics or the hospitals. So try and stay away from like large groups of people, especially if you feel ill. But also realize that for the most part, most of the time that you have COVID-19, you won't, like when you're most contagious, you won't feel sick. So it's better to be careful even when you're not feeling ill. And that's one of the best ways to avoid a lockdown, is really to distance and to be proactive about it now. People talk about the coronavirus is that there's nothing that we can do, this is unstoppable force, but it really isn't. And there are a lot of things people can do to keep it from getting bad.
Indeed.
To protect their, protect their own, like the population.
Great. Thank you, Doctor. But do you think that we're in a better position to tackle a second wave in Nigeria?
In many ways, you are. The government. So when the first wave hit, the government had a more proactive and a more coordinated response than other governments. And one of the main reasons why the population, just in general, did not get huge, a lot of cases. Well, first there was the government response, but also because there's generally the feeling of community that people feel responsibility for each other's health, and that is one of the a big reason why that when there are feelings of community like that, and people are taking responsibility for not just their own health but the health of everyone around them, that's a good indicator that people are less likely to get coronavirus. It's not like a my health, my responsibility, my problem sort of situation. So they're trying to keep everybody else safe.
Okay.
When they realize they're wearing masks not for themselves but for everybody else, and they're realizing that this is just a temporary situation. We're not trying to get to the point where we're living with the virus. We're just trying to lock down now and then move past this.
Okay, Mollie, clearly awareness is a big deal, not just in Nigeria, but everywhere else. And understandably, lockdown fatigue is also an issue. Could you speak to the issue of vaccine skepticism? Because a lot of people seem to be reluctant, even in countries like the UK, where it's being made available, to take the vaccine, because as far as they're concerned, it's posing a danger, some unknown danger to them. So how do you propose we counteract this, or the authorities counteract this?
I mean, that's a very difficult question, because we see vaccine skepticism all over the world, but we're also seeing that the vaccine, we're very large trials. So each of the vaccines that's going out has a trial of over 30,000 people, and very high rates of either people not getting the vaccine not getting the coronavirus, or if they do get it, then in very mild cases. And so, of course, there's going to be some skepticism, but the looking at the cost-benefit analysis, we can see that the benefit that these people are getting is fairly great.
And as we've, sorry, Doctor, are you done?
No,
okay.
We're just saying that we can see that it works, and as with any new medication or treatment, there will be some fear around it, and there will be we can see that there's some side effects. But the flu vaccine has side effects too, and it saves thousands and thousands of people every year.
Well, at the moment, it would seem as if low and middle income countries have been thrown under the bus by the wealthy countries who have gone on a vaccine shopping spree. But what do you think would bring an end to the pandemic, if I could ask you? What do you think would bring an end to this pandemic, really?
I mean, having a vaccine is a great tool, but I think there's a lot that people can do before they get the tool, or if they don't at all, in order to lock down. Like, there are many countries, Nigeria included, that has had a very good, has had very low rates of disease until now. So, I think there are possibilities if they really lock down, if people wear masks, if they distance. It is definitely possible to eliminate the virus from the population. New Zealand has done this. Taiwan, Thailand has also they have very low rates of the virus as well. So it is possible to get rid of the virus without the vaccine, and I think that is what people should strive for. Because waiting for the vaccine and then, trying to give it to everyone will just be kind of a mess. So doing what they can before, using the telemedicine platforms like CribMD, taking care of their health also, because if they have, unchecked blood pressure or diabetes, if there are other conditions that they have, they're much likely to have worse course of disease if they do get coronavirus. So not putting off other medical care is another thing. But definitely staying distance, wearing masks, especially indoors, and trying to stay, mostly away from other people, so at least 6 feet, and away from crowded areas.
Okay. Well, just following on from my colleagues' aspirations towards when we will see the back of COVID-19, with the rollout of vaccines, especially in countries like America that are peaking, that have the peak figures, what would be the projections for when we should expect a curve in terms of deaths and more cases globally?
Globally, I think we're going to see continued increases for the next few months at least. So right now, if you want to think of the world, like the pandemic, as sort of a burning building, and the vaccine is a fire hose. It would be much better if we were aiming at a controlled blaze, but right now it's not controlled at all. So we're going to just start, blasting it off, and hoping that it will improve the situation, but it will take a while. We are not going to see the end of COVID-19 in many countries for at least a couple of months. Hopefully things will get into control by late this year. It is hard to tell because it also has a lot to do with the way people behave.
Indeed, quite an analogy you paint there with the burning fire and the fire hose with the vaccines. And let me ask you, are you worried that we do not have the peer reviews for most of these leading vaccines that have been given the green light? Are you also worried as a scientist that we do not know much and we haven't done much about vaccines in children, vaccines in pregnant women? Are you concerned?
I mean, there is always some concern, but COVID-19 in pregnant women is a huge. The course of disease is more severe in pregnant women. I think that there has been some. I don't know enough to say about how it reacts in children. I think that if it is indicated for children right now, chances are it is probably fine. Children usually react fairly well to vaccines. There will be a few subpopulations of people who should not get the vaccine or who are recommended not to take it. But these will be very clearly indicated. People who have certain allergies, people who've had, say, Guillain-Barré syndrome. And mostly it will be recommended for most people. And I think that will be, so for the most part, I am not very concerned. And I don't think people should be concerned. There are fairly large trials so far that suggest that it is fairly safe.
Okay, maybe turning our attention to recent news about WHO gaining access to China to trace its origins. What do you expect they're looking to find that could inform us better as we press forward in this war against COVID-19?
I'm afraid I'm not sure what they think it will inform us better at this point. I'm most interested in controlling the spread of COVID-19 and not so much where it came from. I think there are a lot of things that people can do that are, that are prescient to them right now, and to them not getting COVID-19. And if they feel like that is important to do, then I support that. But I feel like the most important thing to do is really to focus on reducing the virus in populations.
Okay, well, thank you, Dr. Mollie. Thank you for taking the time to enlighten us. Hopefully we'll get you back again soon.
Mm-hmm.
Okay.
Thank you.
Thank you.